Hey, this is Erica Starling. I'm going to do the second half of my NU 607 health assessment video. This is the second half. This will be musculoskeletal, and we will go ahead and get started. Hey, Miss Owens. Hey, tell me your date of birth.
11/12/89.
Okay. So we just did the first half of your assessment with the abdomen exam. So we're going to go ahead and do the musculoskeletal now, okay? So are you having any problems with your bones, joints, ligaments, muscles, anything like that? Have you ever had any musculoskeletal surgery? Do you notice any popping, grinding of bones or anything when you do anything? Okay, and you've never had any problems? Never been diagnosed with like osteoporosis, osteoarthritis, anything like that? Does any of that run in your family?
I don't think so.
Don't think so. Okay. All right. So first things, I'm going to just inspect your body and see if there's any abnormalities. I'm going to move your sheet just a second. Your shoulders look symmetric. Your arms, your legs. You don't notice that one leg is shorter than the other. Your pelvis looks stable. Do you have any problems walking or ambulating or anything like that? Well, we're going to kind of start from the top and go to the bottom. So the first things first, I'm going to look at your hands, and we're doing each, normally I would do them bilaterally, but for the purpose of this exam, I'll stay to your left side, but I'll verbalize that we're doing both, okay? So I'm going to look at your hand. Do you have any problems moving any of your fingers? Can you make a fist for me? Can you move your fingers by yourself? Okay, so you have good range of motion there. You've got good color. So you've got good color. So I've inspected it. I'm palpating it now to see if there's any tenderness or crepitus or anything like that. I don't see anything. I don't see any abnormalities in your joints of your hand or your wrist. Your wrist moves freely. Sorry.
Sorry.
Yeah.
It normally doesn't pop, so when you asked me, I said no.
Yeah, it did pop a little bit. All right, so we're going to do your elbow now, and normally I would do both sides also. Your elbow is able to bend without difficulty, without pain. Can you go ahead and just lift your arms up? Okay, and straighten them out. I don't see any discoloration or any abnormalities with your elbow or your elbow joint back here. Do you feel any pain when I touch your elbow back here? Okay. Go ahead and bend it like this. I don't see any abnormalities when I do that. Can you move your arms and your shoulder? Does it have any...
Heather D, you have a call on line 1. Heather D, line 1, Crystal to East report.
Do you feel any pain whenever you move your shoulder? Okay, I don't feel any abnormalities in your shoulder joint. I've inspected it, I've palpated it. I don't feel any abnormalities. In your joint space, I don't feel any crepitus or anything, and I'm not causing you any pain, right? Okay. Can you shrug your shoulders for me? Okay. And you don't feel any abnormalities with that? Okay. I'm going to press against you and lift your shoulders up. Okay. And then I'm also going to check your grip strength in your hand, so just squeeze my hand. Okay. And try to lift your arm up while I press against it. Okay. So your strength is good and everything. So we've tested both of your arms. So now we can move on a little different. We can go with your jaw. Do you have a history of TMJ? Okay, I thought so. So first thing we're going to do is we're going to check your tympanomandibular joint, your TMJ. So we're going to check it for any popping, clicking, see if it slides out of place, okay? All right, just open your mouth. Close it. Open your mouth. Close it. All right. Did that cause you any discomfort? No. I didn't feel any clicking, popping. It didn't slide out of place or anything like that, so it seems normal today. We're going to
Do it. Wrap me up.
Go to your legs, and we'll do that, and then we'll do your spine last, okay? So for this, we're going to test both of your legs, but I'm only going to stick with the left. Do you have any pain in your hips? No. Are you able to move freely? Yeah. Have you ever noticed hip pain or anything like that? Okay. Are you able to lift your leg up? Okay. You can relax it. Push it against me like you're pushing a gas pedal. Okay. And then try to lift your leg up, and I'm going to push it down. Okay. I don't feel any abnormalities in your pelvis or in your hip joints. Try to lift your leg up again. Okay. I can feel your hip moving, but I don't feel any abnormalities. Anything with your femur? No? Okay. I don't feel any abnormalities. I can palpate, and I inspected it. I don't see anything. Your knee, have you had any knee problems? Okay. I can feel your knee or your patella. I can feel the joints surrounding it. Bend your knee up for me. Okay. Does that cause you any pain? I don't feel any crepitus or any fluid collection in your knee, so that should be good. You lay your leg down. Sorry. I don't feel. Do you feel any pain in your shin? Okay. So this is your tibia, your fibia. I don't feel any abnormalities there. So I'm going to go to your ankle now, and your shoe and sock is off. Do you have any ankle problems? No. Can you move your leg? There you go. Does it hurt when you do that? All right. Your ankle moves freely. I don't feel any crepitus or fluid collection in your ankle. And your feet, have you had any problem with your toes? Okay. I see that you have 5 toes on each side. I see that you can move your toes freely. You have no decreased range of motion. Can you feel me touching your foot? Okay, so you have no decreased sensation. Did you have any decreased sensation on any of the other parts? Okay, so your sensation's good. I inspected it. I palpated it. I don't see any abnormalities. I didn't hear any clicks or crepitus or anything like that. So the last thing we're going to do is I'm going to help you stand up. You get down. Okay. So I'm going to inspect your spine. So I don't feel any abnormalities in your spine. Have you had any back problems in the past? Okay. Are you able to bend over? Okay. I don't see any. You can stand up. I don't see any abnormalities. I didn't hear anything. You didn't experience any pain when you bent over. Okay. I saw symmetric hips, symmetric shoulders when you stood up. Your spine looks appropriate with appropriate curvature. You have appropriate range of motion in all your joints. Can you move, like bend from side to side? Okay. And lift your arms up above your head. Okay. So that should be it. All right. Thank you so much for coming in today.
Thanks.
Whoops.